We've been showing you scenes this week of crematoriums operating in some Indian cities around the clock, and our Sam Kiley is at one of them in New Delhi. We can just see behind you so many piles burning. Just give us a sense of what you're seeing, and again, a warning to our viewers that you might find some of these images disturbing.
Well, Linda, just in this area alone, it's about the size of 3/4 of a football pitch. There are close to 50 pyres burning. This crematorium believed it would probably process about 150 bodies today. There's estimated about 600 people dying every day here in New Delhi, but the truth of the matter is the numbers must be much higher. In this crematorium, the dead actually have to join a queue before they can be seen, before they can be given their last rites. People accompanying them have to take a ticket, like you would going to see the doctor or getting a bank appointment, wait their turn, and then they will be brought out to one of these locations. Ghee, which is a butter-like oil substance, poured on them, the wood piled on top, and they're given their last rites, very often unattended by anybody else other than perhaps one family member or a friend. There was one gentleman I spoke to earlier on today who lit that pyre there, and he was in attendance only because no other member of the deceased family could be there, because they had all caught COVID, Linda. This is a catastrophic result of a failure in public health. Narendra Modi, the Prime Minister here, believed a few months ago that India had broken the back of the pandemic, that they'd somehow achieved herd immunity, and India was becoming a net exporting nation for anti-COVID vaccines. Indeed, the national programme doesn't get underway in serious earnest until May the 1st, when the number people from 18 and above will be allowed to get the vaccinations. There's been a rush of applications, but there's nothing like the level of supply that it can be met. And at the same time, he has encouraged political campaigning in local elections for his BJP party, mass meetings, people not being socially distanced at these meetings, and then the Hindu festival of Kumbh Mela, where more than 2 million people are believed to have attended, all cheek by jowl, all plunging in and out of the river Ganges, celebrating this very important Hindu festival for them, but all of them participating in a super spreader event. And I'm afraid this is the result, Linda.
And Sam, we're sorry you have to be there, but it is important to show the world this brutal reality, because there are so many scenes like this, temporary crematoriums set up in parking lots and parks, and you sound as if it's difficult to speak somewhat. Just give us a sense of how you're feeling being there.
Well, this story's not about me, it's about the Indian population, it's about their struggles to deal. There's 1.4 billion of them. If the figures here even remain at the relatively low rate they are in terms of proportions of the population that are dying, that are contracting COVID, even if they were to double or treble, they would still be perhaps below the official figures that have been seen in the countries in the West. But in terms of actual, absolute human suffering, in the terms, one estimate in the United States calculated there could be 1 million dead by August. Many people here believe that could be an underestimate. Yes, the air is thick with the burning of ashes. The ground is strewn with the ashes and remains of people who just a few days ago passed away, mainly because they couldn't get access to hospital beds or to oxygen. There are a lot of very angry people on the streets of India, and it'll be interesting to see whether or not that translates into political consequences for the government, Linda.
And I want to ask a bit more about that, because despite the rising rates of infection, Sam, and the scenes we're seeing behind you, we are hearing from the Prime Minister who, despite all of this, elections are continuing, and he is encouraging people to go out and vote in parts of India.
Yeah, he is. In Bengal, West India, there was voting. There were video pictures of people queuing very tightly close together. Again, super spreader opportunities. There have been a number of opposition politicians objecting to this. There was a High Court not a ruling, but a statement from a High Court judge saying that electoral commissions that allowed these processes to continue might be charged with murder. There is disarray, frankly, in the political families, both in the opposition and in the government, because the focus of this country has been on political gain and not on dealing with the threat that this pandemic posed. There was a sense in India that they had got through the worst, that their isolation had done so much economic damage that Modi had to allow the brakes to come off to allow the economy to regrow, or more people were going to suffer from other consequences of poverty. But the reality is that that was not met simultaneously with an aggressive national vaccination campaign. Less than 2% of the population here has been vaccinated. And as a consequence of that, all of the estimates are that people are going to suffer a great deal more before it gets better. Linda?
And Sam, as we have been discussing, so many people that need treatment can't get it. Hospitals are really struggling to provide oxygen to people who need it. We are starting to see some international aid arrive this week from various countries, the UK, Italy, Germany, Russia. Just explain the international help and what else is needed right now.
Well, the first stage really has been that the United States lifted its embargo on ingredients that could be used, particularly to produce the AstraZeneca vaccine here in India. That was released, so that is allowed to continue. On top of that, the United States has pledged $100 million worth of aid. Some of that, I think, is en route as we speak. A lot of that, and the real focus of most of the aid that's come into this country, or coming into this country, has been a little bit on PPE, some of the antiretroviral drugs that are being given, or hormonal treatments that are being used to treat COVID patient sufferers. But above all, the effort is to just get oxygen into people's lungs. It is oxygen where there has been a catastrophic shortage, and it is in supply of oxygen where, at least in the short term, there may be the ability of many patients that are gasping their last breaths, or what feel like their last breaths, to get treatment as that oxygen starts to come in to the country. But again, this is a country of 1.4 billion people. So if this pandemic starts to really burn out of control, then it's keeping up with the amount of the sheer volume of oxygen is going to be a real challenge. The danger is the whole country starts to feel like it's got asthma. The country could get asphyxiated. There's a real sense of fear of what's coming here. Linda?
Yeah, it certainly sounds that way. Sam Kiley for us in New Delhi. Thank you for being there for us.